there's many causes of musculoskeletal pain, ranging from somewhere where someone's had an injury or an accident, of course. And yes, we all know that as we get older, that our joints can wear away a little bit and get osteoarthritis. So osteoarthritis in older age is a very common form of arthritis and joint trouble. But in particular, kind of younger people or middle aged, there's other things to consider which may not be so obvious. So, as a rheumatologist, one of our jobs is to make a diagnosis and to find out what that is. So, for example, it could be some form of inflammation in the joints, the muscles, the tendons, and this can cause pain. Generally, this will be worse first thing in the morning. People feel very stiff with it rather than towards perhaps the end of the day with osteoarthritis. Then some disturbances of, for example, the metabolism. So, for example, having a hormone problem like thyroid disease, having too much calcium in the blood, having too much iron in the blood even can cause problems, or even being anemic. That can cause the muscles to ache or feel generally sore. And then finally, there are some other situations where the pain system itself becomes abnormal or disturbed. So, for example, people who are under a great deal of emotional stress, maybe from life events, difficulty sleeping, recovering from another illness, they may be under a great deal of stress. This in turn can lead to the pain system just not mopping up background discomfort, and people just develop a generalized pain. This is what we've often seen in a condition called fibromyalgia, and it's really common, much more common than people think. In fact, it feels a little bit like having flu, but a low-grade flu all the time. So there's many causes of musculoskeletal pain. And one of our jobs as rheumatologists is to help diagnose that and then come up with the best management plan. So again, of course, it goes back to what kind of pain, but in general, keeping our musculoskeletal system healthy depends on several things. Now, these are all the kind of standard, average, slightly boring things that we've probably all learned, but keeping exercising regularly, even into older age, is really important. Now, not the same kind of exercise doesn't suit everybody, okay? And the key thing is to find something that suits you that you can do regularly, okay? Now, that could be even just brisk walking, okay? It's got to be brisk walking, not just kind of the, kind of lolling around the shops, for example, but a brisk walk on a regular basis, that for half an hour, say, that's a really good form of exercise. It could be going to the gym, of course. Resistance exercise, actually, using kind of gentle weights, is much better in older age than we would think, actually. So cutting down perhaps on cardiovascular exercise, doing a few more weights, or resistance exercises as we get older, not heavy weights, but just gentle resistance, is really good as we get over the age of 50, actually. Diet is also very important, okay? There's lots of links now between how the gut bacteria, the microbiome, interact with the rest of our body. Even our brain actually sends signals from the gut, can go to the brain, affect inflammation levels, hormone levels, all sorts of things, even mood. So diet's really important. Then sleep. Okay, if you really don't rest your muscles and joints overnight, then you're waking up already kind of in a state where they're tired or fatigued. And that's night times when they're resting is the only time they really recover. Okay, so diet, sleep, exercise, these things are always important. And perhaps knowing a little bit about how your body's made up. So, for example, some people have extremely bendy joints, extremely mobile joints, and they will, from an early age, find certain sports they can't do. They will be tripping up much more frequently, for example. But most dancers, most cyclists, swimmers, many dancers are hypermobile, and that helps them do their thing. So some sports suit some people, some don't, okay? And learning what your body makeup is really important as well. I would often use several things to help with musculoskeletal pain because although, yes, traditionally people think that doctors just throw drugs at people for helping musculoskeletal pain. In fact, that might only be for a very short time in certain situations. But rehabilitation involves exercise, but the right kind of exercise, often guided by a physiotherapist or other specialist. Pilates-based exercises, where you're really looking at the kind of core muscles, particularly to support the joint. So, for example, some people aren't aware that if you have back pain, then in fact, it's really, really important to improve the strength of the abdominal muscles because they provide a kind of a splinting at the front as well as, and so that takes pressure off the back. So exercises that may not be so obvious are really, really important here. I find that some people use acupuncture with good relief for certain types of muscular problems, particularly, and they can provide a short-term pain relief, but sometimes it's not quite so long-lasting, okay? But acupuncture can be helpful in the short term. Alternative therapies such as supplements, well, I prefer not to use vast amounts of supplements, I'll be honest with you. I think diet contains almost everything we need if we get the diet right. Although the one thing that's difficult is vitamin D. I think in winter months, about 50% of the population becomes slightly low in vitamin D. Just in this country, that is, because the angle of the sun is so low that it filters out all the UVB, which is what we need to make vitamin D from our skin. And that's actually the main source of vitamin D in humans. We get very little actually from our diet. The only sources really are oily fish that are of any meaningful amount. So vitamin D is the one supplement I suggest in winter months between October and April. So these are some of the things that can be helpful. So I think if it's been going on for more than a few weeks without any obvious improvement, then I would say that's the time to start thinking about getting some medical help. Things to particularly look out for: joint swelling, okay? If you have swelling in one or more joints, if your pain is particularly bad in the mornings rather than the evenings, these are things where it might suggest inflammation in the joint, okay? And particularly if you've not injured your joint, that's when you should really see a rheumatologist, okay? In general, if you have had an injury, then the general advice would be rest, using ice, elevation, and, you know, those are kind of general supporting things for an injury. But many times I see people who haven't had an obvious injury and are in pain. And I think if it's going on for more than a few weeks, then that's when I would suggest they see somebody about that.